Hi, Jamie Davis here again from NACCHO Annual 2013 in Dallas, Texas, and we're going to be looking at a very serious issue, talking about youth violence and prevention of child mistreatment, coming right up here from NACCHO Annual. So let's go ahead and introduce our panel here. We have Barbara Ferrer, we also have Karen DeSalvo, and Becca Stavengord. I got that right? That's right. Good, good. Why don't we go around first, and Barbara, why don't you introduce yourself and tell us a little bit about your background?
Sure. I'm Barbara Ferrer. I'm the Health Commissioner for the City of Boston, run the city's health department. We're both the oldest health department in the United States, but we're also a fairly large health department. We have about 1,100 employees, and we do some very traditional public health services and then some less traditional public health services. We run Boston EMS, and we run a large sheltering program for people who are homeless. One of the things we've really focused on over the last 10 years is building health equity in the city of Boston, and one of the reasons why we initially became involved in looking at issues related to violence and violence prevention was that violence is an issue that disproportionately in the city of Boston affects people of color, children of color, and young people of color in particular, both on the maltreatment side but also in terms of street violence and community violence.
Karen?
I'm Karen DeSalvo, and I'm the Health Commissioner in the City of New Orleans. Been in that role for about 2.5 years, and prior to that was living in the city, but in a much different role, really, as more in academics and teaching. So this has been a really great jump into the world of public health and an opportunity to take our health department, which is old but not as old as Boston's, and transform it into more of a modern version of what public health should do, protecting people where they live, learn, work, and play, and thinking about social determinants. And as part of our transformation of our department, we have undertaken a very intensive community health assessment improvement process. And in that, every meeting we have, every listening session, every conversation, violence comes up as a major issue. And for our city, in particular, that's around murder, which is how it culminates. And our murder rate, unfortunately, for the past 40 years or so, has been 8 times the national average. And so the mayor has charged everyone in city government, but certainly departments like health and the police and the criminal justice system to focus every resource and attention on getting that murder rate down so that people can have the peace and prosperity that allows them to have the quality of life they want. So this is an area that is near and dear to my heart, but also near and dear to the hearts of everyone in my city, because we want there to be opportunity for all to feel safe so they can then focus on the other things that they want to do.
Great. And Becca?
Great. My name is Rebecca Stavengord, and I'm the Violence Prevention Strive Coordinator for the Multnomah County Health Department that's located in Portland, Oregon. And Strive is a demonstration project led by the CDC. It's a 5-year initiative that really, the goal is to bring the public health approach and primary prevention into existing conversations of violence prevention. Most of those conversations have been focused around intervention, suppression, and reentry historically. So this is an exciting opportunity for us to bring a public health lens and lenses of community empowerment and community engagement into a conversation about prevention.
So, and Karen, you posed the initial question I'm going to ask here for me. It seems to me that it would make sense that dealing with child violence, youth violence, is something that would be a one-on-one relationship between a healthcare professional and an individual who's been a victim of violence. Why does public health have a stake in that?
The first thing for everyone to understand is that the data is increasingly clear that exposure to violence in your family, home, school, neighborhood, environment actually creates biologic changes in the body and the brain over time. And so there is a physical impact as well as an emotional impact on people's overall health. And if you're concerned about health, which health departments are, that makes it a priority. For some communities, the prevalence rates are pretty high, and so that also makes it important. What's really great about this national recognition by especially elected leadership like mayors that public health has a major role to play in violence reduction is that it's thinking about prevention. It's thinking about the tools of public health that are epidemiology and approaches like multidisciplinary approaches and collective impact where everyone takes a role, and bringing together youth voice and community empowerment in ways that more traditional techniques we've used to deal with violence, like the criminal justice system and the public safety system, which tend to be a little more hierarchical and have different tools, have been successful in some ways, but haven't really been able to stem the tide in the way that we all want to see. So it's a suppression model. This, with public health, is a real opportunity to prevent and to break the cycle.
Excellent.
I think also, there are two other comments I'd make that I think are important. One is whenever you acknowledge that it's a public health problem and that we're going to work on prevention, you actually make a very strong statement that it doesn't have to be, that violence is preventable. I think oftentimes, like, you'll find, like, deep down in our hearts, in the hearts of many of the people who live in our neighborhoods, there hasn't been this belief that in fact you could prevent most, if not all, of the violence that people are experiencing. So I think one really wonderful attribute that public health folks bring to the table on this is that it is a preventable problem, and that we don't have to constantly be investing in the suppression side of it. We actually can do some investing in the prevention side of it and really see some long-term changes that reduce the burden of this issue as it reduces the burden of other diseases. And I think the second thing about public health that I find interesting and in some ways compelling as to why we should be at the table is we have very good examples of places where we have made a huge difference in the past when people have moved away from looking at a problem as an individual choice or an individual issue and really seen that there was a role for people to look at this as either a community problem or a global problem, a universal issue, and then think about approaches that actually change the environment. So I want to talk about car crashes and seatbelts. I want to talk about tobacco use and all of the associated illnesses with tobacco use. And I also want to talk about sort of the ability to change norms in terms of behavior around preventing unwanted pregnancies, preventing sexually transmitted infections, including HIV and AIDS, and really the profound role that public health has played there, either by itself, but more and more in partnership with a whole bunch of other folks, as bringing about sort of a change in social norms. And I think, when we talk about sort of building peace across the country and building peace in our neighborhoods, we talk about resident engagement and changing social norms.
Kind of looking at not being reactive to a problem, but being proactive. And we to date have been historically reacting to an injury, the standard medical approach to a problem, rather than looking at the global healthcare issue that is violence in a community. Right.
Our systems, and in a certain respect, even us as individuals, we're conditioned to think about things at that individual level, and not necessarily conditioned to think about things at a community or a social, societal kind of space. And so the opportunity to do violence prevention from a public health approach gives us a chance to look at the social determinants of health, the root causes of violence, and the inequities that are built in to that. And so really kind of unearthing that, and that's a value of having public health at the table, because the systems that have been charged with crime prevention or violence prevention historically have had that intervention and reaction sort of responsibility, and we are able to then add to the conversation by addressing some of those earlier root causes.
So what are some of the things that we can do? You're involved in a program that is taking solid, concrete steps. I guess that's why the CDC has said, let's go try this for 5 years and let's see what the effect this has. How long have you been involved with that? How long has that process been working, and what does the program do?
Yeah, STRIVE actually stands for Striving to Reduce Youth Violence Everywhere, and it's a 5-year initiative we have 4 sites across the country. Boston is one of the sites, Houston, Texas, Salinas, California, and then Portland, Oregon. And what we've done is convened a multi-sector coalition, and I'll talk a little bit about what that looks like in Portland. That coalition does an analysis of the data that we have available, fills in some of the gaps with what we don't know or what we need to think more creatively about, and then prioritizes risk and resiliency factors within the community, ultimately leading up to the implementation of some type of best practice or evidence-based strategy. The strategies historically also take that lens of a more intervention or a more individual level. So the research and practice around violence prevention is evolving. And I think that this project is an opportunity for us to contribute to that. What we are doing in Portland, what we found with our coalition, is that we had a decision-making structure that wasn't representative of the authentic engagement that we wanted to see from communities. And so we reshaped the way that that body worked. And what we found now is that our opportunity to go into the communities with a platform of trust and collaboration and leveraged resources is really enhanced by taking kind of front-loading that approach to engage communities on the front end.
What are some of the things that somebody that wants to say, I need to implement some sort of violence prevention in my community, that even if they're a small community, the violence has become a problem everywhere?
Where do you start? So there are a host of evidence-based programs that are available depending on where along the life course you want to begin intervention. It depends on where the major challenges are in your community, so an assessment of whether the issues are around murder in adolescence, as it is in our community, or if it's shootings or stabbings or domestic violence, family violence. Following that, the good news is there has been a lot of great work done to know what might be effective. In New Orleans, we have thrown everything we can at our challenge, and have done that from 0 to a pretty well middle age. But most of our problems in adolescence, that's where they seem to need a lot of immediate support, but have other efforts in that area. So there is resources through the Prevention Institute, also called Unity, through the CDC, and through the Department of Justice, as well as a host of other efforts that are underway, for example, through HHS, to look at family supports and ways that we can address mental health and substance abuse in families. So there's plenty of opportunity. I think that the way that the message that I would send to people, at least from what we have learned thus far at home, is that I was saying this earlier today with this group, that even tuberculosis, which is a concrete microbe that has a treatment, it takes multiple drugs, and it takes environmental change, it takes addressing the host's family and making longer term changes in behavior and life so that you prevent its recurrence. So violence is a lot like that too. There's not going to be one silver bullet, as they say. It's going to take a multitude of approaches, and what's exciting though is that there are programs that we know work, and just as she's describing, when you get in the community and you begin having this dialogue, they are genuinely relieved and excited that there is an interest on the part of the government and other structure, especially public health, to really think through not just the suppression model but prevention.
I think what's interesting and what's been exciting is there's a real, I would say there are 3 things you have to have if you're going to try to do violence prevention anywhere in the country. And, certainly from what we've learned. I mean, the first is you have to be willing to engage in partnerships. And, that's probably some of the hardest work. Public safety has for a long time really been responsible for curtailing violence. And they have some very good tools at their disposal. On the other hand, they come from a public safety framework, using a public safety framework. Public health has a whole nother tool case, and I would say residents have their own tool case that they bring. And if you're really going to think about building an effective strategy, you're going to have to be able to communicate amongst people who come from very different places, have very different tools at their disposal, and may see the problem and the solutions somewhat differently. So I can't emphasize enough, can't go this alone. Can't go this alone. Whether you're the public health department or the police department, can't go this alone. I think the second thing that folks have to recognize is that as hard as it is to take a long-term view, you need to shut off the pipeline. And whether you're dealing with child maltreatment, or you're dealing with youth violence, or you're dealing with dating violence, you have to start early and thinking about what kind of relationships people have with each other, what kind of relationships people have with their community, what sources of support do you have to sort of help people early on get the kinds of skills that we all need, all of us, whether you're rich or you're poor or you're black or you're white. You need to know how to negotiate this world, how to negotiate relationships, and how to manage your feelings, including your feelings of anger. And we have to have an emphasis on making sure that we have skill-based programming available to everyone. And I would say the third principle or strategy that somehow has to get woven into this is people have to make sure that the voices of those most impacted by violence, whether it's your residents or women if you're dealing with violence against women, or children, those voices have to somehow be front and center. And oftentimes the helping agencies, the government agencies, the nonprofits, the church groups, faith-based community, all the folks who are very well intentioned forget that the reason we're all going to work in partnership is because the focus has to be on those people most hurt by violence. And oftentimes those people most hurt by violence also are those people who then turn into folks who will hurt other people. I'm hurt, and my way of reacting to being hurt is to hurt somebody else. And I think if we keep residents and victims close to the center of both the conversation and give them the voice to help direct the strategies and the work, we're going to come out in a much better place.
And I hear you saying partnerships, that it's very important, and partnerships across the spectrum of the community, the private organizations, the faith-based organizations, other governmental agencies. You talked about how those partnerships look in your area.
So our coalition is approximately 40 to 45 different individuals, and they represent different sectors. So we have some folks that come from local government, some folks that come from law enforcement, from the health care field. We have faith-based organizations. We have unaligned community members who maybe this is the first time that they have really felt welcome or engaged in a process that ultimately plans for the community that they live in. We've actively engaged with a number of youth-serving organizations, and then we also have young people who serve on the coalition. And that actually means changing the way that we structure the opportunity to be at a table, too. Sometimes it means changing where we have the meetings, what time we have the meetings. At our meetings specifically, we have food that's provided, so individuals can sit and we can share a meal together. We also provide childcare at our meetings, so that it's not a barrier for participation, to just be able to say, okay, I'm going to come and I'm going to be involved, but I need to bring my kids with me. So that's opened up a lot of pathways for more authentic engagement. We also have some individuals within our health department. We have engaged community health workers on this project, and so there are a lot of different names, the umbrellas that you can call community health workers. We have outreach workers, we have parole and probation, we have gang outreach officers that are all at the table authentically and one-on-one kind of engaging the community in these conversations. And if community members either can't come to the meeting or don't feel welcome at the table yet, then the individuals that are having these real-time conversations with them are there to share those stories, and that's really shaped our process.
So, as we get ready to close out here, do you have any final thoughts for that public health service out there that's saying, I think I want to delve into this? Is there any final advice you'd offer them?
That's a big one.
Good luck.
Do it.
Just do it.
Just do it.
Yeah, I guess it's really difficult. So I won't candy coat that. It's difficult work, and it is a challenge. But the partnerships that we've developed with different systems, they've been very welcoming of having public health there at the table. And once you can figure out how to blend kind of our jargon with their jargon and the terminologies and all of this, we're really just trying to accomplish the same goal, but from maybe different perspectives. And it's not about being in your own lane anymore. It's about carpooling.
that?
Yeah, we've said it before, and I just underscore it. We bring a lot to the table in this conversation about violence reduction, and it's not just a conversation. We're able to bring structure and action, and we have the ability to take that long-term view that's really necessary. And the community and the criminal justice and public safety partners are hungry to know that there are diversion opportunities, that there are prevention opportunities, and that we're considering a larger socio-ecological model than the one that they are, that they often need to. And so I say just do it, and I don't mean to be flippant. I mean, it's really important that we step into this space and that we're undeterred by differences in vocabulary and culture and structure, because we have the right, I think, skill sets to be able to handle it, but we have to make sure we're committed, and that really requires, I think, a change in thinking in a lot of ways about what chronic disease is and what the origins are. And that's why at the outset I brought up the science piece, because it's important for the public health world to recognize and consider this is an important social determinant of overall health.
I also think it affects a lot of people. So I think, wherever you are in this country, forms of violence have unfortunately become, sort of a routine part of life for many, many people, and in particular for many, many children. So there are studies that show that children under the age of 6 have had tremendous exposure to violence, and the trauma of those events, is lifelong, and and can have horrific effects on their life course. So I think, if for nothing else, we have a good, as Karen said, we have a positive role to play and a contribution to make, but it's also a problem that affects millions and millions of people, and we can make a difference.
Well, I want to thank all of you for joining me here and having this important discussion, and hopefully someone watching this will be able to reach out and make that decision to just do it, to just go out there and work on preventing violence in their community.
Thank you. Thank you for having us.
And I want to thank all of you for checking out this episode of the segment recorded at NACCHO Annual 2013 in Dallas. Make sure you check out all of the other segments from all of the other topics that we covered here. You'll find all of that over at naccho.org on their site, as well as our channel at promednetwork.com.